The journey of Daniel. At age of 35, Daniel, months from his wedding, decided to solve something that had disturbed him since adolescence: successive episodes of arrhythmia. Daniel scheduled an appointment at the cardiac center. Coincidentally, this day he woke up arrhythmic. How was it possible for a young guy? Daniel remembered having reported his parents feeling pain and burning in his hands and feet, but they used to think it could be anxiety or just an excuse for not going to school. Pain became usual, but he found a way to get used to it, like not playing football with friends. During some clinical visits, doctors have suspected of arthritis, but he grew up with nothing but suspicions. By that time, diarrhea and stomachache became more frequent. David lost a lot in his social life during adolescence. He felt like not being shirtless in swimming pool due to small red spots in the belly. Frequently depressed and sad, a new warning was coming. Going back, Daniel decided to visit the cardiologist, since the episodes of fatigue and arrhythmia became more frequent. The cardiologist requested echocardiogram, MRI, and ECG exams, and also investigated the history of cardio disease in Daniel's family. Surprisingly, echocardiogram results came out with an alert. Results showed that Daniel's heart presented concentric hypertrophy, pointed by the ECG increased Sokolov index, and the MRI indicated fibrosis. His heart was giving a signal. Time to connect the points. Daniel also reported family cases of chronic diarrhea, heart conditions, and close relatives with chronic kidney disease. The combination of results indicated that probably the pain was not a fantasy from Daniel's head. It was time to investigate the possibility of Fabry disease. To have it confirmed, he performed an enzymatic test, which demonstrated less than 1% of enzyme activity. To certify the diagnosis, Daniel underwent a DNA analysis, and the result was a pathological mutation associated with classic phenotype of Fabry disease. Fabry disease is a genetic disease caused by egg galactosidase A deficiency. The enzymatic defect leads to progressive accumulation of the glycolipid glybultriacylceramide in the lysosomes in the cells of most organs. This accumulation in the heart affects the myocardium and endothelium, causing release of growth factors and oxidative stress, in addition to myocardial hypertrophy and coronary microvasculature lesions. Among adults with Fabry, the heart disease is characterized by progressive myocardial hypertrophy. Conduction tissue is affected, and it may progress to a pacemaker implantation. Symptoms of Fabry disease may change throughout life. During childhood, the patient commonly faces pain crisis, intolerance to extreme temperatures, and hypohidrosis and hydrosis. In adolescence, early adulthood, the patient usually complains about fatigue and develops proteinuria. And in adult life, more serious symptoms and severe complications of Fabry disease can affect the patient, such as renal insufficiency, cardiovascular complications, and also cerebrovascular disease. Fabry disease is an X-linked genetic disease. An affected male only transmits it to his daughters, while an affected female may transmit to both daughters and sons. That's why the family pedigree is a powerful tool to help clinicians identify at-risk family members, establish the inheritance pattern, and early diagnose potentially affected relatives. Daniel has been diagnosed with Fabry disease and is under treatment, but his journey is not ended yet. Now his relatives will undergo family screening. The earlier the diagnosis is made and treatment initiated, the better are the chances of avoiding irreversible complications. Make the difference and reduce dramatically the journey of patients like Daniel. Be aware of the symptoms and ask yourself, why not Fabry?